I loved being a doctor. I loved every day waking up and looking forward to having a positive impact on my patients and their families. And I loved not only my patients, the children, but I really loved the medical students, interns and residents, being a teacher of medicine.
Humanism in medicine lost one of its greatest champions this year. Dr. Arnold P. Gold, founder of the Arnold P. Gold Foundation, died in January at the age of 92. Arnold was born in Manhattan in 1925.
Arnold was a product of the Great Depression. He experienced a lot of sadness around him.
From an early age, Arnold knew he wanted to be a doctor.
When Arnold's father died, his mom had to figure out how she was going to help Arnold get into a medical school in New York, because most poor Jewish boys went to the City College of New York, and there were quotas. He was finally accepted at the University of Lausanne in Switzerland. There was a caveat. He had to study in French. Arnold didn't know a word of French, but in typical Arnold Gold fashion, Arnold went off 3 months early to Europe, and he sang in the cafes, he made friends, and within 3 months, he went off to Lausanne, and he was graduated at the top of his class.
Over the next 30 years, Arnold P. Gold became a renowned expert in the new field of pediatric neurology.
I have the honor of having been one of Arnold Gold's students. I don't think anyone who comes in contact with Arnold leaves without realizing you've had a wonderful experience with a brilliant clinician and a brilliant and kind and compassionate man.
Arnold had an uncanny ability to connect with his patients and with their families.
Often we would find him at the hospital on the floor playing with children, and he would often examine a child through the neurological exam, playing.
In the 70s and 80s, technological advances and accelerating scientific discoveries began changing the very nature of healthcare.
He and I were both distressed by what's happened or what's happening in medicine. The world is so speeded up compared to the world that Arnold and I started with in the 1950s and early 60s.
The growing threat to medicine's humanistic foundations became all too clear to Arnold one day while seeing patients with his students.
He was making rounds with his house staff, and they didn't know anything about the child that they were presenting, and introduced him as the brain tumor in room 207. And Arnold, in questioning them, they didn't know anything else about the child.
In 1988, with Columbia Medical School as their first partner, Arnold and Sandra began their ambitious defense of humanistic care by launching the Arnold P. Gold Foundation.
We knew it wasn't going to be easy, and we never thought much about that. You know, we just knew that we were on the right track, that it was the right thing to do, and we just understood that medicine was doing the best it could.
Working out of their living room, Arnold and Sandra set about their mission to change the very culture of medicine. Certainly the white coat ceremony is the sort of the flagship program of the Gold Foundation, in the sense that that's where it started.
We're seeing the impact of the Gold Foundation in terms of recognizing humanistic qualities, really holding up as examples those physicians and nurses and other healthcare professionals who really do manifest the humanistic qualities that I think Dr. Gold and Sandra Gold embraced with the idea that they brought forward to create this wonderful organization.
Over the past 30 years, the Foundation has had a profound impact on medical education and on the quality of the healthcare patients experience. Its message continues to inspire the next generation of doctors, nurses, and the whole healthcare team.
Treating a patient is not just about treating their symptoms, it's about treating the person in front of you and making a connection with the person in front of you.
It's not just a nice thing to be kind and compassionate. It's critical to being the best doctor you can be. incredibly important.
The Arnold P. Gold Foundation has lost its founder, but the important work must and will continue.
You're only half of a physician if you're just good at your craft. Unless it's coupled with patient-centered care and humanism, it's suboptimal care.